Connaught Hospital na one of the oldest government hospital dem na the country, wey dem be open am 11 during the colonial period, but be later reopen am May 5, 2006 by the late President Ahmad Tijan Kaba, wey the hospital im main purpose na for treat sick people, save life and do other things dem wey related to medical business. But over the year, plenty people don dey raise serious concern but how the hospital don dey loss in value. Inside dem people here say the hospital no get better medical facility for do the work, and sef say the way and manner how doctor and nurse dem can treat patients dem wey dem can carry go na the hospital no good.
Wetin happen say when dem come, the people dem not able for attend to them. And myself been don get similar something like wherein you come because dem get the triage, dem get outpatient before ever you go to doctor. That side na what you see them call the outpatient. The nurses dem what dem take you come, dem go send you to this or dem send you to this. Then they say middle condition, dem go send you to this. And if una don see ambulance, this na a matter of urgency. This na emergency something. Una supposed to be able to attend to them. At least una supposed to attend to the nurses them. What dem go near this is no, me I know the right to. Dem go under this, I know I know the right to. Dem go under this vaccine. This na the mama na don't dey na this condition. Dem don't forget that one day.
We call ambulance. The ambulance go take her. They respond quick. Dem go take her. Now we go and carry her hospital there. And the nurse said, you go look at me. You go look at me. You go look at me. You know to me, I go look at me. Say, I go for ambulance. No, I'm not saying it's people also. Hey, can't patient. We don't know to nurse. I know sabi the name. We not to doctor. We not to nurse. Oh, can't patient. If you don't die, so how we go know? If you are not treat them, if you are not.
This hospital since when I come back, they don't diagnose me when I treat it. And each one $100 I spend. Since that they treat this guy, the money no give for popular. In body they say liver, body they swear, but they do test, they give me no answer. I don't do test more than 10. I Connaught Hospital.
Inside them people just carry on say where they can carry them sick people them na the hospital. One concern where then doctor ya can raise say most of them na volunteer them.
So say they don't work there now about 9 months. If you say they're not even gonna pay who, say 90% of staff they wouldn't do who. They're not even gonna pay who. They volunteer, nobody volunteer for. They're not even the whole salary. They're not done. Now they're not pay. They even show me the text after this query what it say they put their salary. So anything what they do under now out of humanitarian feeling. So well, we're not going to understand this. I said, well, can I at least don't see them here? Let the nurses them back, they will rush and do their job. Because if you did it, you are nurse, now for go save life.
Yeah, the doctor can't tell you volunteer, you know. But if you can't volunteer, you know, so they don't pay you. Yes, also not force you. They say volunteer. And then other patients they say privilege, but let me go attend to.
With all them concern here, where them people had always, but the hospital make the chief medical officer, now the Ministry of Health and Sanitation, Dr. Amara Jambai, say no doctor no get rights for say entire for treat patients because them take oaths for that.
The ratio of people to doctor, maybe it don't come up by hard day, then you say we are tired. Now, lab will do this, lab will do this. But that's not an excuse for letting us save life because we don't swear for that. I'm sure as we improve, as the numbers they become more and more, the competition, the relevance for stay into the equation, you will see people will fall off. Those bad ones will fall off. It's a spinning wheel. If you are not good, you will fall off the rail, and it will be difficult for you to pick up a good job.
Usai in continue say the challenge them where government hospital and they face for treat patients them now because the country no get reach 500 doctor them. And self, the government hospital them no get better medical facility for do the work proper one.
The number of doctors to the population very, very low. The number of nurses per our own population still on the low side. Thus, we need for bringing quickly numbers. With the number of doctors, we know say low. They're on the low side. As of now, we not even reach 500. They tell you say we need for fast track and maintain even the numbers, those young ones that we have within. And by so doing, for maintain a system or a group of people, it means therefore bring in the right scheme of service, right salary scales. Maybe we need for improve on some of these things. There are many. You post people down to the district. we need to build packages that will encourage them for stay.
Dr. Amara end up say the ministry dey try for put law dem in place wey go bet any doctor wey no dey treat dem patients dem, as e say the role of doctor dem na for save life. We be try forget the head of Connaught Hospital, Dr. Falodin, for make e respond to dem allegation here, but we no be able get am. For the Society for Radio Democracy, Leone dey report.
According to research wey plenty organization dem don dey do na salon, show say plenty woman can die the term wey dem can go born.
I don born a road. The first pikin na road I born.
Rugiatu Masare na 31-year-old woman wey dey live na Yahweh Chiefdom Kailaun district. It in experience and born pikin business na that part of salon.
The second pikin back na near the water na there I born. Na there I born the big water who for cross of Bukavu. At times, like it always say, they say, "Oh, go there near the hospital. Tell me not there for born." But if you dey at the hospital now, the food business and the person not there, they for let get food. In morning, some people in there they no can get that. They make like dinner for go born left na hospital let them born there. Government provide. If na hospital no bag get that, now we area.
Media to continue say, and don dey witness plenty incidents them wey can be during the term wey woman then can go born, and one of them situation they are na Usa in big sister been die after wey he been born na bush.
One of his sister back in get belle. Belle stubborn na net middle net na belle at na tell the TB they all follow the woman. Oh, after we cross the water na in tie you see no able go again na dey e born as he born no more. Oh, we then take the pikin then dress her then jam close then say lord go as he grab na for don die big sister. So we go the young baby would cry then once then can man then they can't take the body, they return now village, then go bury now. So at times now so it can happen too because the distance for going to the hospital now far.
Apart from the challenge where they say in the get for reaching a hospital, condition them na the hospital them na one way they say no good. Comfort Coca na nurse na Malema Yahweh Health Center na the Yahweh Chiefdom Kailaun district.
Mobility business we dey get am so difficult to we don't get an our center Malema center we don't get am, and the hospital one the labor room is too tight, so any kideu but woman they can 2-3 together, then but 2 better woman they come together 3 safe, the one 2 there labor room, the one in the office to me na me the deliver the nurse they deliver the other one there. So when they born the postnatal is there, but the bed all good, the bed they will me can meet them to better bed. The hospital now there admission place for people they can sit for that admit them chance there is so that will constrain the way they did at the community.
For sake of all this, make one local civil society organization, WashNet, don't complete 1 6-month maternal new child health program na 5 community them na the Yahweh and Peje West, Chiefdom na the Kailaun districts. Sandy Masako na the advocating officer for WashNet.
We did one with Harvard University in the United States of America, and now just a 6-month project. So we target 5 communities then because now pilot project. The project they focus on how we can able for protect kingdom where they within the age of 1 to 5, and also pregnant women then for get access to sitting mothers, and also for men and get access to health facilities at the various communities then. With the coming in of this project, it will help for like create an interface between the health sector and the district and also the community people, and so that the health problems will be solved. So that at the end of the day, we will see reduction in picking in die business in this country and this particular part of the country. We will also see the improves to health facility by the pregnant women them and also that of the lactating mother.
But how this project will work for help reduce them challenge here, Sandy Masako again.
We also get for engage the Ministry of Health when we get back to Freetown, and also present this to them, say these are the challenges where people in this part of the country are facing. But before maybe doing that, we really need for also work with the DHMT and the districts here for see how best they can able for improve on the service. As
Masako say, WashNet go engage with the Ministry of Health for see how they go able solve the challenge where women then can face pambon picking business. Community people like the Peje West and Yahweh Chiefdom say they hope this could able solve the plenty challenge where they can face pan well body business. For the Society for Radio Democracy, Musa S. Kamara.
Plenty organization can complement government in efforts towards well body business. MSF na one organization wey don dey complement government in efforts for promote well body business na the country. As this organization we don dey operate na Konedugu and Falaba districts since 2016. Now this organization don fold up October 31st this year, and dem dey work closely with the Kabala Government Hospital for the past year dem. Well, for sake of this ceremony, I've been talked to the matron at the Kabala Government Hospital, Frances Pierce.
MSF been start for work with April 2016. Now they start the operation on the clinical side, now the maternity, the pediatric ward, the triage, IPC, and the ER. But unfortunately, the mandate done, and this handing over very much jittery a bit. Because where MSF been there, we get workers them, especially volunteer nurses and other clinical staff and other ancillary staff like porters, cleaners. MSF been they give an incentive and they pay them every month. But when they can't hand over now, that's our worry. That incentive they can't done, and we not get enough human resource for cover the entire hospital for run all the units here.
The matron carrying and talk about how this organization done they save life them for the past years.
Number one, they assist in the area of referrals. They go out and come with patients them. So that's why they help. Even like Mongo, when are in the operation areas, if they only charge the patient, then they can take that patient they clear and go back. Then they be advantage. Even the picking them safe, if they discharge, they take them care and go back. So all land be advantage for them. So when they say they can't fold up all land, then they say we talk about governments, even for the area of the ambulance services, because that is now one of the key areas, the area of referral. Because the patients come at the hospital very late, we have very little to do. But if they come early, we will able to take care of them. But if they come very late, it will be sad. So that area of referral is also key in the government area. So that area of ambulance service, we also have to let them speed up so that they will come to pass.
Seni Salifu Samura, na the secretary na the Kabala Government Hospital, Sef bin get this for say.
The way how they don't come develop the hospital to certain standard, we go really feel them because they reflect na different areas. But as hospital management, we work very hard for to keep them to that particular standard day.
We understand say MSF build more than waiting house for the people in this part of the country. Tell we how we are going to continue for maintain the standards of that so that people them will not belong and then will continue for live long.
Now one of the biggest they do way before say we no go ever forget them. Now it creates a very big impact for the people of Konedugu and Falaba district because presently we they get people them where they come up from a far distance where they can the way them belly cannot take 36 weeks where they wait for delivery where they can get complicated. Then can come for them can the where they can get safe deliveries then and then they reduce the maternal death in the district. Now MSF don't go. We get a lot of challenges. The area of fuel, the area of human resource, the area of security. We get a lot of challenges. We want Labour government really help with.
Radio Democracy not tap there. It go before and talk to some comrades where be the benefits from this organization.
My name Fatma Tassise. I come Yifi. Me pikin na in well in private na in Sweden. I can hospital. Then they help me now for me now. But the MSF they back and they can't go now. Now me 2 weeks and some days so I can so I not pay nothing. They feed me money. They feed me even. Where MSF they? Would they get like compound clean? Would they get sufficient job? We are Papa government now for help we for let continue what the MSF they do for me.
Me na Gulu Samura. We don't count to Pikin Naya. Then don't try for it. Then they give them food. Time not the fail. We do come on our house. The Pikin body poor. But now in body don't fine. Where then they can't go so. They feel them and they cry.
I'm at Samura. Now I come out from Ghana. Then take 2 months and 2 weeks. I did an MSF in the check here. You can have in the shop. No nothing. Even they sick in body safe. But now in the sick in body they cry. When they can't go so. We had don't boy because I don't know. Who's they pull milk forgive me picking. They suck body. The Papa government they try help we. Who's this and they come and replace down there. We go glad for down there.
Now all them I turn the mic to the public relations officer of health and sanitary, Solomon Rogers, for tell we what in there as ministry go do towards them issue here.
Government they in the process for recruit 1,000 health personnel this year, and by next year government they recruit another 2,000, and as the case may be we will get for continue for recruit health personnel so that by the time you know it we will get service delivery all over this country. And at the same time we will not get for worry but any other thing, say MSF don't go and whatsoever, in as much as they are development partner, government of any kind always they respond to the needs of the people. And this government here, I feel say they up to that task because the beauty of this government now capacity building, decentralization of services, clinical services, laboratory services, and so on and so forth. So we not get for worry about anything. So this government they up to the task, it don't step up. And also the ambulance services, right? Government don't launch and the pilot and a pujon, and then they roll out across this country. So we not worry, everybody go be satisfied.
Mr. Rogers end up for tell plenty thank you to MSF for them good work where them be done they do for the people then. Now that part stay in the country for the Society for Radio Democracy. Me na Elizabeth Y. Kamara.